Welcome to the Therapist Thrival Guide. My name is Miranda. I am here with Amy, and today we are talking all about dissociation. Amy, do you want to go ahead and introduce yourself?
Yeah, thanks so much for having me, Miranda. It's exciting to talk with you, and I really appreciate the invite into this space. I am Amy Wilkerson. I'm a licensed independent clinical social worker practicing out of the Twin Cities. And I have been practicing social work now for probably just over 20 years, which is mind blowing to say out loud when I say that.
Wow.
Fireworks are popping out of my head. Um, and I've been in private practice for just now 5 years. I was getting pretty burnt out in the field, just getting buried down by so much bureaucracy and policy that was just not really in alignment with how I wanted to give care. And so I just kind of took a leap of faith and opened up my own practice so I could just be as creative as I wanted to be and not felt limiting by all the other things that come along with our field sometimes. And so I have just really loved being able to connect with my clients. I identify as an attachment trauma therapist. And so I do a lot of work with complex trauma, specifically with adoption and foster care, but also a lot of work with military and dissociation and other forms of things that come along with complex trauma.
Awesome. I'm so glad you're here. I first met Amy. I first connected with you over Instagram because you share so much awesome stuff over there. So I'll definitely link to that in the description. But then you were a facilitator at the Permanency and Adoption Certificate program that I went through, PAC, and you yourself went through PAC as well. And so that was a really, really meaningful. That was a really meaningful training that I went through, a fellowship that was like a year long. I talk about it a little bit in this podcast too, but yeah, you were one of our guest speakers. And I remember one day in particular, we were talking about, we were doing like a case consultation, and you just had so many amazing tidbits and just a lot of wisdom to share about trauma related dissociation. And ever since then, I was like, you need to come on my podcast and talk about this because this is so good and this is so important. So let's just start at the basics.
Yeah.
What is dissociation? What are some symptoms of it? I feel like it's kind of like a very therapy word that people sometimes get wrong. But what are the symptoms?
Totally. Dissociation is a scary word. I think it's okay to name that. I think a lot of people can get freaked out, especially in the clinical world, about dissociation because it's kind of tricky and seductive, and it isn't always as straightforward as some of the other things that we see and how they present. So that is helpful and not helpful when we think about it because we kind of know some parameters, but it also, we have to be kind of like on our toes too and like kind of look at it through the lens of like, could this be dissociation? So I think it's important for people to know that we all dissociate in some capacity. This isn't like, severe mental illness that, this it's a normal human experience. And I kind of like to think of it as like the brakes to a car. I think that's how I even explained it at the PAC program. Like if we're going to slam into a wall in a car, we're going to put the brakes on to try to like mitigate that impact, right? And so when things in our life happen that come a little too fast, too strong, our body has its own way of pumping the brakes and saying, you know what, I really can't deal with this right now. So we might notice that of like a super long day with clients, super exhausted, and then just binge a Netflix series. I think I'm guilty of that, and I'm sure like some listeners probably can relate to that experience. That's acting in a dissociative state. Where it becomes tricky, though, is when that becomes the norm, and that is the pattern that your system is constantly seeking. So I think of dissociation as like the act of not realizing something. It's too painful, too hard for my nervous system to get in touch with whatever it is that I'm noticing that I'm avoiding. And so our system takes on all these brilliant ways to keep us away and distract us from realizing the pain and the hard. And that can be like a chemical response in our brain where we just like get really fuzzy and foggy. It can be us kind of like checking out for a little bit and kind of losing time or even losing our memory in more trauma related dissociation. We can actually have amnesia from that. It can be keeping ourselves really busy throughout the day and not wanting to just slow down and feel things. I know sometimes that can be a symptom of it, but it shows up in so many different ways that can be so specific to each person that it's hard to say, I think, exactly what dissociation, how it, like the perfect formula of what it looks like. But a lot of times, even like substance abuse in itself is an act of engaging in a dissociative practice
Sure.
to not stay present, right? And so I think there's such a spectrum of how dissociation shows up, which, before we hopped on, I asked how long this was going to be because I could go on about this forever, forever and ever and ever.
Well, so what causes dissociation? Is it always trauma?
No, I don't think it's always trauma. And especially like, it could just be more intense phases, right? Like a move, a big life transition, not being able to take in the full scope of it, maybe a rupture recently in a relationship, and knowing that you have to get through your daily living and it's just too hard to turn towards it. So I don't think it has to be like always this big T trauma. Like I said, we
Hmm.
dissociate when things just feel like a little too overwhelming in the moment. Trauma related dissociation, though, I think is when we're really avoiding something deeper in our nervous systems, and our nervous systems just don't believe that they'll have the support or the capacity to turn towards it without feeling flooded.
Sure. So would you say that like for trauma related dissociation, is it going to be more intense symptoms then, or is it, or I guess not necessarily?
Yeah, typically that's what I would expect to see, and that's typically what brings. Those are the symptoms that typically bring people to session. So, for example, we all have responsibilities that we need to do throughout the day. Like I know you're a mama, so like getting your kids up in the morning, having them brush their teeth, making them breakfast, get their backpacks ready, coming home, maybe cooking dinner, taking them to their dance or whatever they do. But if something really big plopped down in your life one day, your nervous system kind of has to make a choice, and that choice isn't always obvious. But am I going to attune to this big distressing event that just happened in my life? Or am I going to, on some level, recognize that I can't really process through that because I won't be able to make the dinner, go to dance class, do all the things? And so we engage in like these different strategies, I guess,
Mm-hmm.
to avoid that big thing, and we kind of just like bury it under the rug.
Mm-hmm.
And because we're human, and most humans that I know don't like being uncomfortable, I don't. We tend to just kind of like, if we get really skilled at brushing the things underneath the rug, the symptoms can kind of come out more. We can become more avoidant. We can start having more panic attacks. We might start getting feeling like that analysis paralysis. We might start, having some more depression. We might turn to
Mm-hmm.
substances. And these are the things that are typically drive people into therapy. And then once we start peeling back the layers, we realize this is a lot of our body dissociating and different parts of us kind of coming online to run the show to protect us from whatever it is that we're trying not to realize. Does that make sense?
Yeah, absolutely. So, like, I guess I'm just thinking through, let's say somebody went through a really massive trauma and they've kind of swept under a lot of like the emotional numbing, a lot of the symptoms that we're talking about. They have just had a lot of avoidance. Would you say that, like, would then triggers to the trauma, would it come out in more dissociation or kind of like more of these symptoms? Or I guess I'm just thinking of like certain clients of mine who have been through really big traumas and how like they're like when they're triggered, it it can look so different. Like it might look like a panic attack, it might look like dissociation.
Yeah, I think that those triggers can definitely push people into deeper dissociation. So, how our memory works with implicit memory, there's explicit and implicit memory. And implicit memory is also really sneaky because it's the memory that we don't have like the imagery with, right? This is the
Mhm.
memory that our bodies only have 0 to about 3 to 4 years old. We only have implicit memory. And so that's more of like a deeper felt sense or like a deeper knowing. I know that I'm safe, or I know that I'm hungry, or I know that my
Mm.
needs are being met. That's what our implicit memory has. And in the trauma world, and I'm sure you've heard this before, like what fires together wires together. So there can be two totally random things. And if they're experienced at the same time, the brain has this brilliant way of pairing them together, right? So if every time as a little kid I'm eating bacon, right? And my parents are just like screaming at each other in the next room. years later, I might be eating bacon and all of a sudden have this overwhelming sense of anxiety and have zero
Mm,
idea of like, why am I so anxious? I'm just trying to enjoy
mhm,
some bacon. Like, who doesn't, right? But it's because what fires together wires together. And so when we're triggered, because our implicit memory is so powerful, we don't always understand why we're being triggered. That's why panic attacks
mhm,
I think, can feel so scary and so random because people are like, I was literally just driving in my car and then I thought I was going to die. Like nothing
mhm.
actually happened, but I was in such a state of overwhelm. And if that's something that then we don't have the skills to work through, or we don't understand that we're avoiding the deeper stuff, it can push us into behaviors, or we have certain parts of us that come online that think they're protecting us to keep us away from that stuff, that pain that's underneath. And I think understanding the parts work stuff is important too when it comes to dissociation.
Ooh, I would love for it to like dive into that a little bit more too. Like how, I mean, we talk about parts work a little bit on this episode. Or on this podcast. I'm not an IFS practitioner, but am fascinated by just like parts work in general. And I know that kind of translates into a couple of different modalities. But
Mhm.
um, tell me more about like how does this relate to parts work?
Yeah, so I have training in IFS, but I really lean into structural dissociation model and that also uses parts work. And what I love about structural dissociation is it doesn't name the parts for clients. Clients identify their own parts. So
Mm,
I think that's like a really powerful thing. And I just love that about this modality. But the way I think of parts is as we grow up, we gain a sense of self. So I recognize that what I'm experiencing is happening to all of me. What I feel, what I think, my emotions, these experiencing, like I have a sense that that happened to me.
mhm,
But what happens when we experience trauma, especially when we're younger, is our integrative capacity is just so much lower because we don't have the skills and because our brains just aren't developed to be able to process that stuff. So parts of us can actually get fragmented at the time of when a trauma occurred. So if we had a trauma occur at like 3 years old, there might be a part of us that kind of splits off at 3 and stays there. And whatever I believed about myself, believed about safety, knew how to cope in that moment as a 3 year old might almost get like frozen in time. And so anytime my system implicitly gets in touch again with that feeling, sensation, whatever it might be, again, it could be totally random, then that 3 year old part of me might come online and say, hey, I know how to handle this. This is what I did back then to protect you. And as
mm.
an adult, we typically don't want to be functioning from a 3 year old perspective, but that's what might be happening. So what in a lot of the work that I do with parts work is we get in dissociation is we learn about these different parts of self. And the more complex our trauma, the more complex our parts. And we get to get them more in alignment to a more time oriented perspective to be able to say, okay, I like no longer need to work this strategy that I once had to that helped me stay away from this stuff that kept me from not realizing. Does that make sense?
Yeah, yeah. So then, I mean,
Yeah.
how do you feel like the parts work then targets the dissociation? Because I can see how, like, when you're doing parts work, it helps you kind of reintegrate some of those maybe the traumas or the senses of self, and it helps you make sense of what happened. But how does it target the dissociation?
Yeah. So dissociation, because we're not realizing what is coming up for us, it keeps us not being present. It keeps us
Mm,
away from a time oriented perspective to help us make decisions that are clear and balanced and from that logical thinking part of our brain. And when we're functioning from a part of self, that part of self has its own strategy from a part of time that is just not time oriented. And it's the strategy is literally there to keep us from realizing the pain, right? So, for
mhm,
example, one thing I see a lot in my work working with adoptees is deep, deep fear around romantic relationships. It's the first time the nervous system is getting that vulnerable again, like
mm,
it ever had. And the only other time that a nervous system had ever been that vulnerable was with biological family. And so the intimacy of that sensation of that level of vulnerability implicitly triggers this part of self that believes I'm not safe here. And so to avoid that pain of that connection, of like that pain or fear of that rupturing again, or that sense of rejection, a part of self might come online that tries to control the situation all the time. If I'm in control,
Mm-hmm.
right, then I'm not realizing the pain of what's driving that. I'm I'm distracting myself by thinking that I'm in control of like how close I get to this person so that I can please them so I don't end up getting rejected. And it keeps me away from that deep, raw aloneness pain that I don't want to realize. So I function from a place of I'm going to control the situation. I'm in control of other people. This part of me believes that I'm in control of their emotions.
Mm-hmm.
And it helps me avoid the pain of what my true fear is of being rejected again. Does that
Mm-hmm.
make sense?
Yeah, no, that makes a lot of sense. So then for people who have these different like implicit memories or these different parts of themselves that maybe happened at a really, really young age, uh, how are they able to even recognize some of these different things? Is it more of being able to recognize the symptoms and being able to think through like what traumas happened in my past that could be leading to this?
Yeah. I think it's often a combination. In therapy, I think it's often a combination of like really creative support. So I don't think that talk therapy for dissociation is always the best thing because it can flood the system really quickly. And then the body's like, I don't
Mm,
know the stuff that I'm noticing. And because I work with complex trauma, a lot of times my clients give the feedback of like, I thought I was going to come to therapy and just like start feeling so much better. And I'm like, but it feels worse, doesn't it? And they're like, yeah, I don't get what's happening. And I always tell them, your body has worked so hard at not realizing. Therapy is a direct call to start realizing. And if you don't have
mm-hmm,
tolerance for that, it's going to totally feel scary and overwhelming. That makes so much sense. And I'm so
mm-hmm.
thankful that they can share that. And I try to like give that disclaimer up front. Like this actually might feel harder before it gets better because of the dissociation. And I think so to answer your question, I think there's like some modalities like EMDR and DBR that can be really great pairings with some parts work while also building like the skills to notice what's happening in real time,
Mm-hmm.
ground the system and to call the system into like full presence. Because I think then that it helps kind of like attack like these new skills, but also have the or builds tolerance to turn towards the stuff that we're not
Yes.
realizing, while also like
Mhm.
how do I take care of myself in the process when that feels so overwhelming, so I don't continue
Right.
to disassociate. Yeah.
Well, and I think that this is the part that I was trying to make sense of. And so you went right there because with dissociation, it kind of feels like there's like in the moment skills and in the moment things that you're dealing with. But then when you're talking about trauma related dissociation, it's also you have to be pairing it with actually dealing with what's underneath or what's underlying some of that because I could teach my I could teach my clients all the grounding skills that they could want or need, but the dissociation would still continue to happen unless you are really like getting to some of the underlying issues and like some of those fragmented pieces of self that you're talking about.
Yeah.
Um, so then, wait a second. What's DBR though? You said that, and I didn't know that one.
It's a newer modality. Like it's a lot newer. It stands for everyone thinks I'm saying DBT, but I'm not. DBR is Deep Brain Reorienting, and it's a modality that was started by Dr. Frank Corrigan. It's a brilliant modality. I'm so excited for it to be out there. I think I encourage every clinician who's working with trauma or dissociation or people who have attachment wounding to look into this modality because for my community as an adult adoptee who serves this community, this is like the game changer, and I'm so excited for it. But it's a modality that really focuses at how our system first orients to the threat before it even becomes a cognition. So a lot of modalities like EMDR, a lot of other really amazing modalities include the cognition piece of it. But DBR really focuses the moment the shock enters our system before we even have a cognition of, oh my gosh, I'm scared. So for attachment wounding, it's so brilliant because it helps us release shock from our system that then helps us turn towards things that maybe once we were fearful of with a lot more tolerance to be able to process through that without our systems holding on to all that shock. So it's a really fascinating modality. Yeah, it's just really it's incredible. I'm so excited about it coming to the field.
How does it do that? Like, how do you I mean, I think a lot of people are familiar with EMDR, but, like, how does it do that before? I mean, how does it work?
Yeah, so let me see, how do I explain this? So I think it's like one of the reasons why I'm so excited about it is because I think it's the most aggressive. And I don't mean that in like it's so activating, but I think it works through the trauma quicker than any modality I've ever seen, but it's the most gentle.
Hmm.
So a lot of people with dissociation or complex trauma sometimes can have a really hard time with EMDR because it can be
Mhm.
super activating for the dissociation. There's lots of tips and tricks to like soothe that, but I think um, it can be really hard. It can be really activating. Where
Right.
DBR, so the way I think about it is if I'm sitting in my office and a dog barks outside my window, my nervous system is constantly assessing every second, am I safe? Am I safe? Am I safe? Am I safe? And that can switch at any moment's notice. So if I hear something outside, say it's a barking dog, my system orients to that bark. And then I have oh, it's just a dog barking outside, right? That moment though of like, I don't recognize what that sound is, that moment of impact where my system orients to that threat of not knowing what it is, I have the cognition to know I don't need to like brace myself for anything. But
Mhm.
say it was you and I having a conversation, all of a sudden you give me a facial expression that lights up my implicit nervous system. And I think, oh my God, I'm in threat. There's a moment here where like rupture is happening right now. For somebody with attachment wounding, that can be like shocking for the system. I'm not safe here. I'm not going to be
Right.
here. So what DBR does is it recalls that activating stimulus of that moment that the shock enters our system, and then the
Mhm.
therapist helps coach that shock somatically back out of the system.
Hmm.
And then it helps bring so much relief through that process. Um, so yeah.
That is fascinating. I need to look into this because I mean, a lot of the clients that I see have connections to adoption or foster care, and um, I've thought about getting EMDR trained. I've thought about Air Network. I've thought about some of these other modalities, but exactly what you said about EMDR being a little bit more not threatening, but just not as gentle with some people that have gone through attachment ruptures, or even for people who have like pre-verbal trauma, or like some from what I've heard it's not always the best modality for that group of people. But you're EMDR trained though, right?
Mhm, mhm.
Okay, so do you use it with people who have like pre-verbal trauma?
Yep, I do. But I've since been trained in DBR. I use it a lot more because I find
Okay.
that it goes a little bit deeper in the brain.
Mm-hmm.
It goes much deeper in the brain. And I feel like the somatic light up that happens in the body, what I've found is it's so much more gentle than it's, I guess I should say, from my experience
Mm-hmm.
as a client and as a clinician. So as someone who's done it as a client and also someone who does it with my own clients, I feel like it's so much more gentle, and the activation piece doesn't seem to be there between sessions in the same capacity. It doesn't mean that it's always easy or
Mm-hmm.
comfortable, but I think, soothes things differently. Um,
Yeah.
yeah, it's just I've had different feedback on that in EMDR.
Oh, that's so interesting. That's very cool.
Yeah.
Okay, so kind of this leads to my next question, but other modalities and like skills or things that you recommend or have seen to be helpful with dissociative disorders, or even just people who are experiencing dissociation?
Yeah. So I love parts work. Structural dissociation is a really cool modality as well. And anyone curious about complex trauma, I would really encourage you to get trained in structural dissociation or even IFS. But me personally, I just love structural. EMDR, DBR, somatic work, all that stuff is really great. And just really enhancing things that are grounding, things that can bring us back to the
Mm,
present moment. And I think a lot of times the myth is that our goal is that we're calm and that we're always like zen. And I don't think that that is really the goal. I think the goal is to be regulated, which is so different than being